paint a picture for us of the sort of developmental concerns children are experiencing in your region, and what are the trends that you're seeing?
Wagga covers a huge area, so we see a lot of kids. You can hear me okay? A lot of kids, so everything from 0 to 18. And I reflect on when I started as a paediatrician 8 years ago, so I consider myself a relatively new paediatrician. And even in that time, we're just seeing increases like, I can't even explain to you how high, but increases of everything. And that's particularly behavioural issues and mental health issues. So the trends have risen just in the last few years of children requesting diagnoses or needing diagnoses for issues such as ADHD, so difficulties with their attention, requiring diagnoses or having concerns with autism. We're seeing much larger rates of that. We are seeing higher rates of younger children and children that have been missed. The older kids with developmental issues and particularly speech issues tend to go missed. You wouldn't think easily, but it is easily missed until they're quite hard, and along with difficulties with communication becomes behavioural difficulties then. And we're seeing big increases in complex behavioural issues. So when I did my training, we learned how to manage eczema, we learned how to manage asthma, all the acute things. And now what we're seeing by far the most of is really complex behavioural difficulties, emotional dysregulation, physical violence, verbal violence, kids that parents just can't manage them. And so these rates are increasing hugely for us. It's become to the point where on a GP referral, the first line is, please see this kid for a cough, because they know that that's likely to get the attention. And then the rest of it is, and this child also has concerns by the teacher for its behaviour. The parents are not managing, they don't sleep, and the list just goes on. So a lot of our trends now are much more behavioural based.
I think as well it's the overhang from the years that we've had in COVID times where kids have not been around other kids or other families, and that these developmental needs being missed. So it's not uncommon down where we've got very, socially vulnerable families, and the first access they're having to any sort of health care or developmental care is when they hit primary school. So these kids, 5, 6 years old, some of them are still in nappies, not toilet trained, not speaking clearly, and the services are just not there to pick this up early enough.